Thank you, Elena, and thank you everybody for being here today. A big welcome on this afternoon. We have some great news to announce today, and we'll get to that shortly. Before we do, I just want to take a moment to introduce some of our executives and others in the room. Our CEO of Orlando Health, David Strong, standing in the back. Next to him, Senior Vice President and President of Foundation, John Bozard. I see Carrie Giordana, our President of Arnold Palmer Hospital, here at front. And Kelly Norstead, our new President of Winnie Palmer Hospital, who's going to and making it quite a name for herself. So welcome again, Kelly. We have a lot of our foundation board members, our foundation president, Richard McCree, and our Arnold Palmer Medical Center Foundation, Scott Weiss, President Scott Weiss. We have a lot of our donors are here. A lot of our senior management is here. This is a big day for us. A lot of our physician leaders and nursing leaders. What I'm here to talk about, just briefly, is birth defects. Birth defects happen. They're something that we all have sort of gotten used to. But there's been advances of late. We're able to detect birth defects while the baby is still in utero through things like ultrasound and MRI. And there's a special birth defect called spina bifida that we're able to detect in utero. And over the past years, there's been opportunities to improve the long-term outcome of these babies once they're born through intervention while the baby is still inside mom. And that's called fetal surgery. So what we're here to talk about today and really announce for you is the introduction of fetal surgery to Arnold Palmer Hospital and Winnie Palmer Hospital and Orlando Health. It's going to have an impact on a greater family than just the patients and families of Arnold Palmer and Winnie Palmer Hospital. This is a rare thing, fetal surgery is. It really is something so rare that nobody else in Florida has it or does it. And it's so rare that the nearest center to Orlando that does it is in Nashville, Tennessee. So this is something very unique and something very special, and we need to recognize it for that. So talking specifically about fetal surgery, it's taking a mom and a baby, an unborn babies, and putting them both to sleep and doing surgery on the mom to then do surgery on the baby while the baby's still connected to mom. That's how simple it sounds, but it's quite complex. It involves a huge team of people. It involves lots of training, lots of program development. The team is bigger than the number of people in this room to tell you how much training and how many individuals get involved and how many specialists have to get involved in that. So we started talking about this years ago, and we actually started recruiting for a neurosurgeon over a year ago, and we found one. We found a neurosurgeon who's not just a neurosurgeon, but is also a pediatric neurosurgeon, and not just a pediatric neurosurgeon, but also a fetal pediatric neurosurgeon. A very rare individual indeed. And there's only 6 of these programs in the entire United States, to give you an example of how unusual this is. So we managed to talk Dr. Samuel Elbabaa into coming to Orlando Health and working here at Winnie Palmer Hospital and Arnold Palmer Hospital, and to develop a team and to build this program for Orlando Health. And in short order, that happened. So, I'm not going to introduce everybody on the team, but, needless to say, there's physicians and nurses, there's neonatologists, there's anesthesiologists, there's perinatologists, not to mention, the neurosurgeon and the perinatologist surgeon who operate on these babies directly. A quick story, we found a young lady named Ashley Barrett about a year ago who unfortunately had a baby diagnosed in utero with spina bifida. It turned out Ashley is an employee of Orlando Health, and we were in the middle of developing our program when she was introduced to us with this unusual problem. And we met Ashley and we said, that sounds like a great opportunity for you to be the first patient for us, but we're not quite ready. And so we sent Ashley to Kansas City, where they have a program, a mature program already, And not only did we send her, but our team went with her and traveled with her to accompany her and to learn and to bond as a team, if you will. And the team came back. Ashley came back having surgery done on her in Kansas City, and we waited for her to deliver, and she delivered a few months later. In the meantime, our team continued to develop its skill set and has done surgery on a couple folks of their own since that time. But I do want to take a moment to introduce Ashley and her husband Jeff and their baby Max and thank you, everybody who's been involved in the development of this program. Thank you especially to the foundation members who are key to the success of everything we do here at Arnold Palmer and Winnie Palmer Hospital. And without further ado, I'd like to introduce Dr. Elbabaa himself.
Thank you, Dr. Hakim, and good afternoon, everyone. And thanks so much for being here today. My name is Elbabaa. I'm a board-certified pediatric neurosurgeon, and I'm a medical director of pediatric neurosurgery and the Pediatric Neuroscience Center of Excellence at Arnold Palmer Hospital for Children at Orlando Health. I have been privileged to perform fetus surgeries for the last 8 years, having performed more than 60 procedures within the last 8 years. As you have just heard, it's taking a great deal of work to get to where we are today. I first want to give some recognition to the team that has made this possible. So would the fetal surgery team and fetal surgery steering committee stand for applause, please? We all worked very hard behind the scenes to make this complex surgery a safe intervention for both the mother and the fetus at the same time. Coming from a busy fetal surgery center, I was truly thrilled and honored, felt very honored to work closely with this wonderful team who showed the highest levels of excellent care, and they meticulously executed all the fetal surgery protocols we developed together. On the day of fetal surgery, there's typically between 15 and 20 people in the operating room. Each person has a very critical role, and they are uniquely qualified to perform their specific duty. This takes an army, and I'm so very proud how each of these people has jumped to start this program. So now the exciting news. I'm happy to share that we have now performed 3 open fetal surgeries here at Orlando Health to repair spina bifida defects inside the womb. Our first 2 mothers have already delivered their beautiful babies and are doing wonderfully and showing good use of their legs, and none of them so far required any brain shunt. Now, this procedure is not experimental. There is a scientifically proven evidence showing that fetal surgery for myelomeningocele is a safe intervention and has a great impact on both the fetuses, the newborns, and babies and children in the future. There was a federally funded study called the MOMS trial, the Management of Myelomeningocele study, that showed that babies who have had fetal surgery were less likely to need a brain shunt at birth to drain the spinal fluid, and they had better use in their lower extremities with improved motor function in their legs. I was recruited to start this program last year, and we opened our Fetal Care Center in November of 2017. I truly believe it was the right place and the right time to establish this program to serve not only the Central Florida area, but the entire state and the Southeast region. Here at Winnie Palmer Hospital, we are at one of the largest delivery hospitals in the country. And as such, we have one of the busiest neonatal intensive care units in the country, and we have 142 NICU beds, and we treat more than 1,600 premature and low birth weight babies every year. In Central Florida, unfortunately, we have a large number of children born with spina bifida, and we have a great need to have a fetal surgery program in this region. The burden of traveling out of state to have this procedure done can often be too much for the families, and our community truly deserves to have this option right here. Our first case took place on May 23rd on a young lady named Akosua Taylor. The surgery went extremely well. And while this was the first time our team had performed this surgery together, we felt confident in our preparations and protocols to perform it safely for both Akosua and her unborn baby. It felt for me like it was the 50th time we have done it together, not just the first. And the procedure took just over 3 hours. In a moment, I will introduce you to my colleague, Dr. Greves. He's our maternal fetal medicine specialist and my partner during the surgery. The procedure typically starts with Dr. Greves opening the mother's abdomen, similar to how he would perform a cesarean section. He then takes the uterus out, and then we have to adjust the fetus in a position so the back is exposed. The uterus is then opened and just enough to expose the back and the birth defect in the lower back of the unborn baby. The next part is my portion of the procedure, which is a form of microneurosurgery, where the lights are dimmed and I use the microscope to perform the repair of the spina bifida under highest magnification possible. The defect in our first baby's spine was only 2 centimeters. Beautiful baby here. And this part of the operation took 34 minutes. I then hand things back over to Dr. Greves, who performs the closure of the uterus and the skin. I want to stress that fetal surgery is not a cure for spina bifida. I wish it was. However, it's an option for the parents to consider. We carefully go over all the potential benefits and risks with any candidate, and we do a very robust workup and screening for both the mother and the fetus to make sure that they can handle this kind of surgery safely. Fetal surgery decreases the chances the baby will have hydrocephalus or fluid buildup in the brain, which is, and also the fetal surgery can reduce the need for a shunt after birth. Children who may have been wheelchair bound might only need braces or a walker to walk independently or with minimal assistance. Akosua and the baby are doing very well. I just saw them in the clinic yesterday. She was able to go home a few days after surgery, and we kept a close eye on her until it was time to deliver. Dr. Greves performed cesarean section and welcomed Celeste on July 10th. Celeste has the very special and rare distinction of being twice born. She spent 6 weeks in our neonatal ICU at Winnie Hospital for women and babies, and before she went home. Celeste is doing well, and she's here with us today, along with her mom, dad, and big sister, and grandmother as well. It has been amazing to watch the team come together and perform now 3 successful surgeries and to see the fruit of that labor into healthy babies. I would now like to bring up Dr. Greves to share more about the other cases we have done and where we're going in the future. But before I leave the podium, I would like to thank the 4 mothers who went through this fetal surgery. They trusted us to serve them and their families. Their courage, hope, commitment, and dedication to help their fetuses, whom they've never met or touched, is truly a unique bond of motherhood we rarely see. Please acknowledge our 4 mothers, Ashley, Akosua, Erica, and Aisha. It has been a pleasure to serve you.
Thank you, Dr. Elbabaa. Good afternoon, everyone. I'm Dr. Cole Greves, and I'm a maternal fetal medicine specialist here at Winnie Hospital. I've been working here for nearly 7 years as a high-risk obstetrician. Of course, I was very excited the first time I met Dr. Elbabaa and learned that we were recruiting him to begin our open fetal surgery program. This is something I'd always hoped we'd be able to accomplish here at Winnie Palmer. Spent a great deal of time prior to our first case working with Dr. Elbabaa's partner in Kansas City, Dr. Mike Velastos. He actually joined us as a visiting consultant for each of our first 3 cases, supporting us and cheering on our team all the while. Since Akosua's surgery, we've done 2 others, one on July 2nd and another on August 1st. August 1st was actually a very busy and exciting day for us. It was exciting because my partner, Dr. Greg Locksmith, and myself delivered Erica on the morning of Aisha's surgery. So, not entirely expected, but this is how things go in the world of obstetrics. Things went very well that morning, both for Erica as well as for Aisha. Erica is here with us today, if she'd like to wave to the crowd. She's doing great, and I understand her baby Ava is also doing very well. So we've now had 2 babies that have had this procedure, and both are doing great. Our third mom, Aisha, who is also here with us today. Go ahead and wave to the crowd. So we're a little superstitious in the world of obstetrics, and so we haven't actually scheduled a delivery date yet. In fact, every time Dr. Elbabaa asks me about this, Diane, our fetal care coordinator, usually tells him, don't even ask, we're not putting it on the schedule yet, because that's the fastest way to get a patient delivered, is to actually start thinking about it, talking about it, we're actually scheduling it. So we're going to continue to monitor her on a regular basis, watching her very closely until her baby boy is ready to meet the world. So as an obstetrician and maternal fetal medicine specialist, it's a pretty special role that I get to play in this journey, culminating with the final day of our relationship, formal relationship with the patient. That day, of course, is the delivery of the baby. I've always considered it a tremendous honor and privilege to be invited into a family's life during the most critical time. These patients are absolutely no exception. With 100% of my heart, I thank you all for that opportunity and privilege, really. Truly blessed. I'm also excited as our relationship continues in a less formal way to watch these young kiddos grow up, and excited to see them grow and potentially watch how their lives are improved by what we've done here at Winnie Palmer. The future is bright for our Fetal Care Center and for fetal therapy in general. I can assure you we anticipate that now that the word is out, we'll receive many more referrals and have many more opportunities to touch the lives of patients in our community and our state and hopefully our region. Truly, the sky is the limit in terms of what we can do here with the group of people that we've assembled. In fact, any procedure that's out there that's being studied or developed could be available here at Winnie Palmer. And we're committed to expanding these life-changing services that we offer for our pregnant moms. So stay tuned for more exciting news on all of that in the future. As Dr. Elbabaa mentioned, this procedure we're currently doing can have huge impacts on a child's quality of life, and it's a blessing that we get to be a part of that story. To wrap up today's event, I'd like to hand things over to our first patient, Ms. Akosua Taylor, and she'd like to share a few words with you all about her experience. Thanks so much for being here and supporting our program.
Thank you, Dr. Greves and Dr. Elbabaa, for everything you've done for our family. The past several months have been quite an adventure for us, as you know. Better, much better. Now, when I was 20 weeks pregnant, I discovered that my daughter Celeste had spina bifida. At that point, things became a whirlwind. 1 month later, exactly almost, I was headed into surgery. When I first found out that she had spina bifida, I was scared and confused about what that would mean for her and her future. By reaching out to other parents of children with spina bifida in the community, I heard more about Winnie Palmer and the program that had started here. I learned more about the program after coming in and talking with Dr. Greves, Dr. Elbabaa, and the entire team about what the procedure would mean and how it worked. And after a lot of consideration and discussions with my family and with other people, we decided that fetal surgery was right for our family. The pregnancy was difficult, but for us, we believe that it was the best decision for Celeste. I knew I was going to be the first patient here at Winnie Palmer to have surgery, but after spending time with the team, I felt comfortable that I was in good hands. The recovery wasn't easy and definitely had its ups and downs. In addition to recovering, I was also carrying a baby and growing with that. We had some unexpected twists and turns along the way, but I'm grateful that I was in close proximity with the team, and I knew if I ever had a problem, I could reach out to them, and they would be there to help me with anything that I needed. Celeste made her grand appearance a little earlier than we expected at 32 weeks, but as you see, she's here with us, and we are glad that she's now home with our family as well. It's amazing that the tiny scar on her back is from a surgery that she had before she was born, and for years to come, we'll celebrate the day that she was born and her surgery day, her being twice born. So we're very grateful to have that privilege. So again, I'd like to say thank you to the entire team here. We've interacted with so many amazing people through our experience at the hospital over the last 4 months. So considering the situation, it's been quite a pleasure. And thank you to everyone for helping moms and babies like us. I know that surgery was the right decision for my family, and I'm thankful for everything that happened and how all the pieces seemed to line up perfectly right at the right time. Celeste will continue to have care here and at the Spina Bifida Center with specialists from Elbabaa Hospital, and we'll watch her and continue to follow her as we determine what she needs in the future. So thank you for everyone for allowing us to share her story.
Thank you so much, everyone. That concludes our program. We're going to stick around if any of you would like to meet our moms or talk to some of the staff. Thank you guys. Have a great afternoon.